I am Dr. Emily Griffith, and I am the Associate Director of Surgical Services at Altasciences Preclinical Columbia, also known as APC. I am a veterinarian with over 10 years of experience. After graduating with my DVM from the University of Missouri in 2014, I worked as a clinical veterinarian in private companion animal practice, where I performed a variety of routine and emergent surgeries. After joining Altasciences in 2018 as a clinical veterinarian, my aptitude for surgical research became apparent. Over my tenure at Altasciences, I joined the Academy of Surgical Research and have worked on numerous projects with clients and other consultant surgeons to refine the surgical needs of a variety of studies. In 2023, I took on the role of Associate Director of Surgical Services, where I provide leadership and direction for surgical procedures and pilot or feasibility studies for new models. In this webinar, we will introduce to you our highly skilled and educated surgical team at our Columbia site. Our surgery team specializes in surgical procedures and model development designed to accomplish your research objectives while expediting your research timeline. We will explore how our surgical experts can support toxicology and safety pharmacology studies through current surgical services offered and model development. You will also learn how we assist in creating precise models tailored to your study needs through model development, and we will discuss two previous examples of model development, including swine cecal catheterization and canine prostatectomy models. To start off this webinar, we will introduce to you the surgical team at our Columbia site. Renowned for miniature swine research, our Columbia team has years of experience working with all rodent and non-rodent species. Our preclinical facility can perform small and large molecule studies, safety testing, and features in-house bioanalytical laboratories to support both internal and external studies. As previously stated, I am the Associate Director of Surgical Services. In addition to myself, we have two other veterinarians on site with roles to play in our surgical offerings. Dr. Megan Haney is our Director of Veterinary Services and attending veterinarian. Dr. Haney has over 10 years experience in laboratory animal medicine. After graduating from Kansas State University with her DVM, she completed a laboratory animal residency program and PhD at the University of Missouri. She became board certified in lab animal medicine in 2020. She has been with Altasciences for over 5 years and works to ensure animals are properly cared for and processes are in compliance with regulations and the Guide for the Care and Use of Laboratory Animals. She holds animal welfare at the utmost importance in all our study designs and model development work. Dr. Rachel Bardot is our clinical veterinarian, and she is also the attending veterinarian at Sinclair Bioresources. Dr. Bardot is a 2020 graduate from the University of Missouri College of Veterinary Medicine. She received her master's degree in veterinary biomedical sciences from Kansas State University in 2018 with a focus in disease-resistant studies, specifically with porcine reproductive and respiratory syndrome virus challenges on genetically edited swine. Dr. Bardot has over 10 years of experience working with laboratory swine models. Portia Osborne is our surgical technologist, and she has over 20 years of research experience, including GLP data collection. She has over 13 years of surgical experience in a research setting with her SRS, or Surgical Research Specialist, and SRA, or Surgical Research Anesthetist, certifications from the Academy of Surgical Research, as well as LAT-G, or Laboratory Animal Technologist, certifications from ALAS. Our surgical technician has over 5 years of research experience with over 3 years of surgical experience. And surgical technicians assist with the pre, peri, and postoperative care and have advanced surgical skill sets in order to perform surgery. In addition, we also have the availability availability of an additional surgeon with SRS certification that we can utilize as needed. We have 8 veterinary technicians on staff that assist with anesthesia and animal care through anesthetic induction, monitoring, and recovery, in addition to the administration of medications and routine animal health care. Altasciences Preclinical Columbia currently offers a wide variety of both surgical and non-surgical animal models. Our surgical techniques include advanced sample collection procedures, advanced and unique dose routes, as well as induction of various conditions to represent the target therapeutic indication. The models we offer on animal refinement that results in higher data quality and decreased pain and distress in the animals. Today, we will highlight some of the more common models. Please reach out if you are interested in a model that is not mentioned today. At the Columbia site, we perform several procedures that may assist in minimizing pain and distress to the animal. One of the most common procedures is the placement of vascular access ports, also known as VAPs. VAPs are a completely implanted catheter and device that does not exit through the animal's skin. They allow for repeated and long-term access to the bloodstream for either blood collections or administration of materials. The jugular vein is most commonly ported in swine, and the saphenous vein is the second most common ported in swine. The femoral vein, however, is most commonly ported in dogs. Temporary catheters are utilized similarly to VAPs. However, they are only used for a short-term duration, typically less than 2 weeks, but may be used longer in certain situations. These catheters are surgically placed into the jugular vein of swine and are externalized on the dorsolateral neck. They are used for either blood collections or administration of test materials or medications. VAPs and temporary catheters may be used in situations where numerous time points are necessary, such as over 10 and 24 hours, or if the animal will be subjected to blood draws after surgery, or for repeated intravenous administration. Temporary catheters are often utilized if needed for less than 2 weeks, and VAPs are utilized for more long-term success. Some vascular access ports may even last for years. For example, we have several diabetic swine in our colony that are over 5 years of age and still have functional ports. Implanted telemetry is the gold standard for drug development, safety pharmacology, and toxicology studies. By implanting a completely internalized device, it allows for continuous monitoring of several parameters without causing any distress to the animal. In addition, animals may be social housed to further minimize stress. Parameters that may be monitored include, but are not limited to, activity level, core body temperature, systemic blood pressure, ECG and heart rate, respiratory rate and volume, and even left ventricular pressure. We currently offer this service in canine and swine, but could potentially expand to other species. By using telemetry, we are able to collect the most accurate data, as collecting these parameters in restrained conscious animals can result in false elevations and inaccurate data. At APC, we work with a variety of species that are depicted here by these icons, including miniature swine, canines, non-human primates, rabbits, and rodents. Animal models are critical to investigate wound healing physiology and potential efficacy and/or toxicity of therapeutic compounds. Pigs are most commonly used as wound healing models due to their anatomical and physiological similarities to humans. They have tight skin adherence with sparse hair and similar epidermal and dermal thickness to humans. Types of wounds include excisional, where a wound is created by removal of tissue and requires healing by second intention. These wounds can be partial or full thickness. For partial thickness wounds, the wound does not penetrate below the dermis and may be limited to the epidermis only or the epidermis and part of the dermis. For full thickness wounds, the wound penetrates below the dermis and into the subcutaneous tissue or beyond. Incisional wounds are where the wound is created by making an incision. Incision may be closed via suture, surgical glue, or another appropriate method. Thermal wounds or burn wounds are created by applying an external heat or thermal stimulus. Skin grafts may also be part of wound healing models, and we have the skin graft capabilities, including a skin graft mesher. Meshing the skin allows the graft to stretch and thereby increases the area that can be covered by the skin graft. In addition, wounds may be created on the ears of rabbits down to the cartilage. The rabbit ear model is advantageous because the cartilage is highly vascularized, mimicking human dermis vascularization. This model is more similar to humans as the wounds heal through re-epithelialization and granulation formation rather than through contraction. We also offer abdominal hernia creation and repair models. Preclinical animal models remain necessary for assessing biocompatibility, efficacy, and toxicity associated with hernia mesh, medical devices, and other hernia treatments. The defects can be customized based on the intended application of the treatment. Swine are often preferred due to their size and similarity to human anatomy. However, other species may also be used. Exocrine pancreatic insufficiency is a condition in which the body cannot digest food properly due to a lack or insufficient amount of digestive enzymes that are excreted from the pancreas. In this swine model, the pancreatic duct is ligated, preventing excretion of digestive enzymes from the pancreas to the small intestine. Animals must be administered pancreatic enzymes while not actively on study to prevent maldigestion and malabsorption of nutrients and associated clinical signs. We offer sponsors the ability to create a colony of pigs and run several studies within a specified time frame. There are a variety of surgical and aseptic dosing procedures that are also performed by the surgery team. Direct surgical administration of test materials or implants, such as slow drug release implants, may be applied in a variety of locations. Common locations include the subcutaneous space, intramuscular, or even intra-abdominal. Altasciences Preclinical Columbia is capable of most soft tissue surgeries, so please reach out with any inquiries. Gastrointestinal tract catheters may be necessary to administer test materials into a precise location or to bypass certain parts of the small intestine. They may be placed in the duodenum, ileum, jejunum, or cecum. The catheters may be unidirectional and attached to a vascular access port head. This allows for repeated infusion dosing, but does not allow for sampling or collection of GI fluids. Intra-articular injections are performed under heavy sedation or anesthesia and with strict aseptic technique. This is a minimally invasive procedure that allows for the administration of a test material directly into a joint, and the knee or the stifle is most commonly used. For intrabladder or intravesical dosing, a urinary catheter is placed through the urethra into the urinary bladder. Due to anatomy, male swine cannot be used, but we can perform this in females. A direct surgical approach may also be utilized if needed. This route may be necessary for administration of material indicated for bladder cancer or other bladder disorders. Intrathecal dosing is a route of administration via injection into the spinal canal that reaches the cerebrospinal fluid. Test materials may be administered this route to avoid being stopped by the blood-brain barrier. It is also performed under heavy sedation or anesthesia and with strict aseptic technique. Perineural dosing, or dosing directly or next to the nerve, may be performed via anatomical approach or a direct surgical approach, and the sciatic nerve is most commonly used for this. Lymph node injections may also be performed via either palpation of the lymph node or a direct surgical approach as well. There are also a variety of sample collections that are performed surgically. Biopsies are commonly performed on the skin, muscle, and liver, and other soft tissue biopsies may also be performed. These biopsy sample collections may be utilized for histology, PK, or other analysis. Skin biopsy samples may be separated into dermis and epidermis to perform further analysis and determine how deep the test material is penetrating into the skin. Cerebral spinal fluid, or fluid that surrounds the brain and spinal cord, may be collected via a lumbar puncture or at the atlanto-occipital site, depending on species and study needs. These are typically performed under heavy sedation or anesthesia and with strict aseptic technique. Arthrocentesis, or joint aspiration, may be performed for joint fluid sample collection. In healthy animals, minimal joint fluid is often present, and lavaging the joint with a sterile solution may be necessary to achieve any sample collection. These collections are also typically performed under heavy sedation or anesthesia and with strict aseptic technique. We also offer several models that are not true surgical models, but still require involvement of the surgery team. Diabetes mellitus is a disorder in which the body does not produce enough or respond normally to insulin, resulting in abnormally high blood glucose levels. There is currently no cure for diabetes, and the management of diabetes can be difficult and time-consuming. New insulins, medications, and glucose monitoring devices are constantly being evaluated to improve people with diabetes lives. Swine are the preferred species for the diabetic model. Swine are implanted with dual jugular vascular access ports prior to the diabetic induction process. In addition, males are typically castrated to prevent the shoulder shield or the thickening of the skin and to prevent behavior issues. Females may be ovariectomized prior to diabetic induction due to sex hormone interference on glucose regulation. We have extensive experience with this model, including evaluating novel insulins, medications, glucose monitoring devices, and even insulin pumps. Swine are also used for the acute liver failure model due to anatomical similarities to humans. The acute liver failure model requires placement of either a temporary catheter or vascular access port, as well as very defined humane interventional endpoints. The temporary catheters or vascular access ports are used for dose administration, for repeated blood sampling, and for treatment administration. And this model often requires very intensive treatment. In addition, we also offer the ability to perform dental studies involving the options for routine dental cleanings, dental scoring, and halometer measurements. The evaluation of periodontal treatment is of particular value as periodontitis has been linked with some systemic diseases such as cardiovascular problems and arthritis. Beagles are commonly used due to similarities of size of their teeth and periodontal tissues to humans. The natural occurrence of periodontal disease in dogs is high, and they are widely used for periodontal disease treatment studies. Gingivitis may be accelerated by offering a soft diet which promotes the buildup of plaque and calculus. In addition, dental cleanings are routinely performed on colony dogs for routine preventative care. Next, we are going to discuss some examples of previous model development that have been performed at Altasciences Preclinical Columbia. The first example of model development includes the development of a model to perform repeated large volume infusions into the cecum of miniature swine. In the early discussions with this sponsor, they were interested in delivering a large volume of fluid that would bypass the small intestine. They also wanted to deliver it ideally prior to or at the very beginning of the large intestine. In addition, it would need to be repeated once weekly, and we would need to assess fecal form after each infusion. Anesthesia could potentially alter the passage through the gastrointestinal tract and thereby impact fecal form, so administering these infusions in a conscious animal was ideal. Small intestine infusion catheters have been described in multiple species and commonly include sites of the duodenum, jejunum, and ileum. So the question was, can we utilize a small intestine infusion catheter for the large intestine? First, we had to take in consideration the pig's anatomy. The beginning of the pig's large intestine is made up of the ascending or spiral colon that starts at the cecum and ends at the descending colon. The spiral colon in pigs is arranged in a series of centrifugal and centripetal coils, and the coil anatomy can vary between animals, which can make identifying the exact same location in each animal challenging. For this model, we had to consider how impactful it would be if the catheter was implanted in a different part of the spiral colon. And for this, it could potentially impact the fecal form if the catheter was placed towards the descending colon in one animal and more towards the ascending colon in the next animal. So that led us to the cecum. The cecum is at the beginning of the large intestine. It is easy to identify, a consistent location on each animal, and it was easily accessible. So for this pilot, 6 Yucatan miniature swine were surgically implanted with an intestinal burp valve catheter into the cecum. The cecum forms a blind pouch, and the catheter was inserted into the blind end of the pouch for an easy to identify and consistent location in each animal. The top picture on this slide shows the placement of the catheter into the cecum. The catheter was then tunneled to the lateral neck, and a port was attached to the catheter and secured in the subcutaneous space just caudal to the ear. The bottom picture shows placement of the port caudal to the ear. For orientation, the pig is looking towards the left of the slide. In addition, since we have numerously ported animals on site, we also tattooed a green C next to this port head to help designate the port as a cecal catheter port and not a jugular vascular access port. The cecal infusions were performed by aseptically accessing the port on the lateral neck. The infusions were repeated up to once weekly and were up to 6 hours in duration. All animals tolerated all of the infusions very well. This model resulted in a viable option for repeated infusion dosing into the cecum and met all of the study needs. Though alternative methods are needed if sample collection or capsule dosing is required by study design, these cecal catheters provided a sustainable route for long-term fluid administration. The cecal catheters facilitated a reduction in animal numbers and improvement in data quality and reproducibility. And this is done by enabling repeated dosing without systemic effects of sedation. This is a poster that was presented that summarizes the development of the cecal catheter model. It was presented at the Academy of Surgical Research annual meeting and at ALAS in 2021. Kaylee McGinley, a senior scientist and study director at our Columbia site, also presented this poster at the American College of Toxicology annual meeting. The next example of model development includes the development of a model of partial prostatectomy in canines. Due to many shared anatomical similarities, the canine is the ideal animal model for human prostate disorders, such as prostate cancer. In men, a total prostatectomy is commonly performed to remove the cancerous tissue. However, this procedure is difficult to model in dogs due to a high rate of serious complications. For this study, we needed to develop a canine prostatectomy model that would induce the manipulation and removal of prostate tissue to mimic human prostatectomy procedures, while also minimizing postoperative complications associated with the canine prostatectomy, and still allow for topical administration of test material at the time of surgery. Dogs are the only species apart from humans to have significant incidence of prostate cancer, and dogs best represent humans due to similarities in prostate anatomy and diseases they can develop. In developing the model, the anatomy first had to be taken into consideration. The prostate is located between the urinary bladder and the penis, and the urethra goes through the center. In dogs, the prostate completely surrounds the urethra. In a total prostatectomy, or removal of the entire prostate, the bladder must be reconnected to the urethra. In dogs, there is a high rate of urinary incontinence following a total prostatectomy. In human men, complications often include urinary incontinence, erectile dysfunction, infection, bleeding, and the formation of blood clots. We needed to find a model that would minimize the associated complications, as these complications could potentially impact evaluation of the test material. If we could avoid the urethra, we had the best chance of minimizing urinary incontinence, but we still needed to induce manipulation and removal of the prostate, or at least part of the prostate. We also still needed to apply the test material topically after removal of the prostate tissue and to keep the material local to the site. For the pilot, we used 3 male beagle dogs, and through a caudal ventral abdominal incision, the prostate was identified, and approximately 25% of each lobe of the prostate was removed. In this picture, you can see the intact bilobed prostate gland prior to the removal of any tissue. The urinary bladder is being held between the gloved fingers on the top of the screen for orientation. After resection, hemostasis was achieved through manual pressure and the use of a hemostatic sponge. A pocket was also created within the periprostatic fat, and the test material was applied directly onto the prostate within the periprostatic pocket. This pocket was then closed with absorbable suture, and very minimal leakage of test material was observed. The abdomen was closed in standard fashion. While some hematuria and proteinuria was noted postoperatively, there was no observed urinary incontinence or urine retention, and all findings were considered non-adverse. So this model offered a refinement to the more invasive procedure while mimicking manipulation and removal of prostate tissue. Due to the success of this early pilot study, a large GLP study was also successfully completed. This model and subsequent studies may open up the door for new therapeutics for those suffering from prostate cancer or other prostate disorders. Here is a poster that summarizes the development of this model. This poster was presented at the Academy of Surgical Research annual meeting in 2023. Ahmed Abdallah, an associate scientist and study director at our Columbia site, also presented this poster at the American College of Toxicology annual meeting in 2023. Now I just want to take a moment to highlight a few other previous models we have also performed. We have worked with a sponsor to create a model of angioedema in the lips and tongues of swine. The swine cystotomy with mesh placement was another example of model development where the mesh was placed inside the urinary bladder and served to retain some test material within the bladder itself. For the pancreatectomies, we used already diabetic canines and removed approximately half of the pancreas and evaluated its effect on each animal's diabetic state and insulin requirements. We can also perform intracardiac injections, which does include rodents, as we have the capabilities to intubate and ventilate rodents to perform open chest surgery. And the last model I wanted to highlight today is the laminectomy, which is a procedure that removes part or all of the lamina within the vertebra of the spine. And we have performed laminectomies in multiple species and have applied various test materials directly within the laminectomy site or through other methods. So in summary, the Altasciences preclinical Columbia surgical team has over 30 years of combined experience and is ready to discuss your study needs. Through surgery and model development, the Columbia Surgical Services experts can support your toxicology and safety pharmacology studies. We offer a variety of surgeries and models, including non-surgical models. Please reach out with any interest, and we can assist with the development of the study design, protocol, and overall model. We also offer the option of in-person or virtual tours if you're interested in seeing our site. And with that, I would like to open the field to any questions. Looks like we have a few questions coming in. So for the first question, we have a new model we are interested in developing that was not mentioned today. How do we start this process of developing it with Altasciences? That is actually a great question. You can either reach out to your local business development representative or contact us through our website, altasciences.com. Please provide at least a brief description of what you are interested in developing so our BD representative can make sure to involve all of the necessary experts in the beginning conversations. Feel free to also mention me and this webinar too. Next question looks like, we have a study that would require some imaging. Does your site have any imaging capabilities such as x-rays? It's another really good question. Yes, we do have digital x-ray and ultrasound capabilities. These are commonly used for animal health purposes or for study needs. In addition, we also have wound photography and digital planimetry capabilities, and these measure the wound surface area. It should also be noted that we do have the capability to rent a fluoroscope when needed for study purposes. Looks like there's another question. What type of anesthesia and analgesia do you use? For that, we utilize a combination of injectable and gas, specifically isoflurane anesthesia. Our large animals are intubated and maintained on isoflurane anesthesia throughout the procedure. For rodents, we utilize a low-flow isoflurane vaporizer, and we can also intubate and ventilate rodents based on the needs of the study or procedure. For analgesia, we use a multimodal approach where we use a combination of NSAIDs, opioids, and or local anesthetics. But all the medication and anesthetics used are chosen based on the specific procedure and on the study needs. Oh, here's another interesting question. How many surgical suites and what are your facilities like? It's a great question. So we do have 2 large operating rooms that we can utilize. Each of them has enough space for about 3 to 4 surgery tables in each. So we can perform surgery on 3 or 4 large animals at a time. We also have heated surgery tables as well as other heat support, including warm air, bear huggers, heated water blankets. Also have the capabilities to give warmed IV fluids throughout surgery. We have overhead surgery lights, and we do have ventilators for both large and small animals. In addition to all that, we also have patient monitors that can monitor their ECG, heart rate, their SpO2 or pulse ox imagery, as well as the capnograph or the carbon dioxide monitoring that we monitor with every patient throughout surgery. Looks like we just got another question in. This question is, we are interested in testing a few different insulins in some of the diabetic swine. Do you guys offer the ability to have a colony of animals where we can run repeated tests and maybe even modify the insulins between each one? Yeah, that's another really good question. We do offer this. We actually have several colonies for different sponsors of diabetic swine on site. As I mentioned before, we do have some diabetic swine that are over 5 years of age, and these have been used on colony multiple times or on study multiple times, and they can be used for either insulins, devices, insulin pumps, or glucose monitoring devices and other therapeutics. All right, and with that, that concludes our webinar today. If you have any questions that were not addressed today, please feel free to reach out to me or through our Altasciences website, and we will get back to you with those questions and answers. Thank you very much.
Thank you, Emily, for your presentation. On behalf of Altasciences, we'd like to thank you for taking the time to join our session. Enjoy the rest of your day.